My name is Dr. Paul Haynes, one of the pediatric orthopedic surgeons at Seaview Orthopaedics.
I'm Dave Junkin, one of the sports medicine orthopedic surgeons at Seaview Orthopaedics.
We're here to talk to you about a novel treatment for anterior cruciate ligaments called the BEAR. Truly like the animal, BEAR stands for Bridge Enhanced ACL Restoration.
The ACL, or anterior cruciate ligament, is an essential ligament in the middle of our knee for pivoting, cutting, so that's why you always hear the athletes tear it. Anyone can sustain an ACL tear, however when you do, you typically then have instability of your knee. You have difficulty pivoting, cutting, jumping, returning to sports or higher level activity. ACL reconstruction consists of actually replacing the torn ligament. For the longest time, like I said earlier, we couldn't fix it, so we just had to put in a graft. Your body has to take that graft and turn it over in time to become a new ligament. That's a lengthy process, and that's why most people don't return to full activities, typically 9 to 12 months following the reconstruction.
The BEAR procedure, again, it's Bridge Enhanced ACL Restoration, is a true repair of what you already have, so it is not replacing something. The advantages of this are multiple. One of them is a bit easier of a recovery period. We're making smaller tunnels or smaller holes into one's bone, and oftentimes that's a bit easier to recover from. One of the other advantages is that this is your own tissues. You're actually repairing something that was yours to begin with. But it is supported by placing a very strong suture on either end of the bones, meaning the femur and the tibia, to give that repairing ligament an opportunity to heal. In addition, the BEAR is we're actually implanting something, and we're implanting something called a collagen carrier. And the whole idea is we place collagen there and give the environment for that ACL to actually heal. Give it all the nutrients and everything else that it really needs. So there are many people that are candidates for the BEAR implantation, the BEAR restoration. It's not suitable for every patient. We're never going to get rid of ACL reconstructions in their entirety, but for certain patients, particularly younger, particularly with ligaments that have avulsed or partially torn off either end of the bone, they're definitely candidates for that. One of the other criteria that we use is we like to address these ACL tears a bit sooner than we typically would a reconstruction. So oftentimes you'll hear us say, hey, we'd like to do this within 7 or 8 weeks. With an ACL reconstruction, you don't have those same time constraints. So it is important if you do, unfortunately, if you've suffered an ACL tear, to get one of us sooner rather than later.
This is a young individual who had sustained an avulsion of the ACL off the femur, which you can see up in this corner of the screen. We have now placed 2 sutures in a lasso configuration around the ligament, which is right here. This is the tibia bone down below here. And we now have the sutures in place. This is our targeting device to create a small little tunnel in the femur, which we drill from the outside in, so there will be a small incision out on the femur to get to that. Then this is after we place the guide pin for this. Again, here's the ACL that is pulled off. This is just a device to cup the end of the pin so it doesn't advance any further than we want it to. We've now drilled that hole, and we've passed sutures that for this bridging technique. You'll see later, we put in a very thick piece of tape essentially that goes across the ACL to add as a buttress. We now are on the tibia side, so there will be incision down below on the leg where we drill up a pin in a similar fashion. We actually pierce right through the remaining ACL here to create that tunnel. Again, these are very small holes like Dr. Haynes had mentioned earlier. We've now passed all our sutures. This tape right here is a very strong Merceline tape that is bridged by 2 what we call endo buttons. This provides the strut and the stability to the repair. We now have the sutures that we had passed earlier through the ACL also passed up into that tunnel, which we then tie over that endo button. Then we do have to make a small incision, as the BEAR implant looks like a big marshmallow. We coat it with the patient's blood, it becomes malleable and soft, and we then place this into the area, what we call the notch, where the cruciate ligaments reside. It then coats this entire area and performs that collagen bridge or barrier to allow this to heal.
The recovery period, a bear versus an ACL reconstruction, is somewhat similar. Really the only difference is that first month. So oftentimes we'll ask someone to actually be non-weight bearing. It can be anywhere from 1 week to a month, depending on what we see when we're in the operation itself. And the process itself is a little slower in the beginning, but it definitely ramps up at about the second or third month. One of the challenges that we actually have is patients actually feel pretty good a little early. So we have to be cautious, and we have to constantly remind them that, hey, this is not quite yet healed. We still have to give it an appropriate period of time, but it does involve multiple months of physical therapy.
If you were to look at all ACL tears across the board, at about 9 years following an ACL injury, whether it's reconstructed or not, individuals develop arthritis in their knee. We can see that by x-ray, and that's regardless of the age of the individual. The bear technique, we're seeing that not occurring to the same degree. Not only you get to retain your own anatomy, we're not replacing anything, you don't have to build a new ligament, but it appears that it is a much better technique from a long-term standpoint, less arthritis down the line. Dr. Haynes and I have been doing this now for the better part of 2 years, I would say. Collectively, we've done about 25 of these cases, and we're seeing excellent results.
Absolutely. So if it's something that you're interested in, or you just want to come in for a second opinion, or just a consult on this, or just to discuss the procedure a bit further, please come see us or one of our colleagues.